Oh, hello. How's it going? How have you been? It's so nice to meet you. My name is Simon, and this is my associate right here.
I am Matt. Nice to meet you.
It's so nice to meet you. So, we've come here to give you an examination here today of your cranial nerve. But, anyways, what's been bothering you recently?
Yeah, so I think we're gonna just start off asking a few things about yourself. I'll be taking notes here, so Simon, do you wanna?
Sounds good. So, yeah, what's your name again? Okay, awesome. Thanks. How have you been feeling recently? How's your mood been? Okay, fair enough. Have you had any history of medical conditions in your family, or... Okay, that makes sense as well. In addition, how long have you been feeling this way? How long have things felt off? Okay. No, that seems about right. Seems about normal. Yeah. So, anyways, we're gonna be basically taking that information and giving you a diagnosis right here. We're gonna have to run you through a few different tests and make sure you're doing good, and we'll get you out of here right away. Okay? Sound good? Awesome.
Yeah. I mean, you're in for a cranial nerve exam. You said you've been having headaches. A few. Okay, so just before we jump in, I'll let you know a few premature diagnostics. That could induce a cranial nerve exam. Could include lack of sleep, being sleep deprived, high stress, lack of relaxation. So we're gonna hopefully narrow that down for you today.
Awesome. So, first things first, I'm gonna have you open your mouth wide, like that, just like that, and we're gonna go check out to see if everything's good down there. Just keep your mouth open a little bit. Okay, awesome. Thanks. Sounds good.
Alright, I'm gonna need you to keep track of this item. I'm gonna be testing your visuals first. Left. Right. Left. Right.
Simon, do you wanna bring back the flashlight so we can check pupil dilation? Let's do it. Alright, so I'm gonna have you follow this light. Oh, that's the blinking setting. Alright, now look to the right. Right. Now look to the left. Look to the right again. Follow the light. Okay, it looks like we're seeing your pupils are a bit dilated. That is, could be a sign of having this issue, and it kind of makes sense if you haven't been having much relaxation or much sleep, so we'll definitely have to get you figured out before we leave here, and hopefully get you a little more relaxed and a little bit less stressed, and we tend to see that this usually helps patients a lot.
Yes. Alright. So now we're going to be testing some of your audio.
Let us know where you hear the sound.
Alright, can you hear it in your right ear? What about your left ear? Alright, I'm going to tap on this a little quieter and let me know when you stop hearing it. Right there, you can't hear it anymore. Okay, interesting. Write this down.
We're gonna have to ask you a few more preliminary questions just to sort out what you've been feeling and what might help you out. So, you've been saying that you've been having a lack of sleep or lack of relaxation. Do you tend to feel like you have tightness in your jaw? Yeah, that makes sense. Okay, just make sure you look out. And what we're gonna do right now is we're gonna take a few deep breaths and focus on relaxing your jaw, unclenching that. Alright, 3, 2, 1, in. Out. Alright, so what we're going to be doing now is asking a few more questions and maybe more focusing on that relaxation. We know that recently you've been feeling a
Okay, so one thing I am noticing, you're not fully expanding your diaphragm fully, and so a few, notable causes for this is, high stress, high anxiety. You're not, kind of short of breath. You're not fully able to take in all the air. So I suggest you practice that exercise for about 5 to 10 minutes every night before you fall asleep. And midday too, if you're ever feeling overwhelmed, you just take, 5 to 10 deep breaths in at a time. Release it, and then, try to let yourself sink into your surroundings for the next couple minutes, and then you can repeat.
No, definitely, I think that's best. I know that a lot of times we get to these points where we might be feeling really anxious or really stressed. It's important to just remind yourself you have time and to make sure you're not psyching yourself out extra. And so that's what we're here to do, is kind of help you out and help you find that vision.
Alright, so for the next test, I think we should do another visual. We noticed that you had lack of dilation in your pupils, so let's take this.
Right here, we just have a little object right here. It's a little stress ball. First of all, you should definitely get one of these if you've been struggling with stress. They're really fun. But we're going to be doing some visuals here, and just make sure you tell me exactly when you think it's expanding or when it's contracting, and just kind of follow me, expanding, go ahead and just keep imagining this as you stress you. Squeeze it out. We're going to be doing some auditory testing again using this. So, hear it on your left, on your right, right in front of you, on your left, right, where do you hear my hands? My fingers, are they on your left ear or right? Okay, that's good. Good. This one, how about this one? Is this on your left or right? Good to hear. Alright, so now we're going to bring back the flashlight, but we're also going to introduce another visual trigger. So I need you to keep one eye, if you can, on the visual cue, and your other eye in the light. And I want you to try to focus on both. But make sure you keep the visual trigger, the visual cue in focus. That's the most important thing. So, here we go. Alright, we're gonna go up here. And we're gonna come back down. And we're gonna go back up. We're gonna go back down. And now we're gonna cross. Alright, we're gonna go up. Keep your eyes on it. And we're gonna go down. We're gonna cross. Yep. Oh, there it is. Yep. Nice. Alright. I can diagnose 2 or 3 things. Definitely a lack of sleep, 100%. When are you usually going to bed? Okay, let's see if we can push that up by an hour. Definitely. Do you think you can go to bed an hour earlier? Okay. The next thing is you're overstressed, so I think those breathing exercises are good. Most definitely.
If you can find some sort of stress toy, stress ball, something to squeeze and get a lot of that stress out, work on declenching that jaw. The other thing is, you have a lot of tenseness in your brain up in the top of your head, and so one thing we can do is pluck that out. So we're going to spend a couple minutes plucking that out. That should temporarily relieve some of the stress, and you can prevent that from coming back by doing the breathing exercises that we mentioned before. So
definitely what we've been seeing is, within our analysis, like Matt said, we've seen some stress kind of bundled up on the top of your head, so be sure to pluck that out. Right. This is painless, and this will hopefully help you leave here feeling much better. Gotta make sure we have full visibility here. just make sure that you're the most relaxed you can be.
Alright, and now we're going to take any inflammation in the face, we're going to push it out, push it out, push it out. I need you to do that for me. Push it out, push it out. Down and out. Down and out. Down and out. Good, 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 good. Alright, that's very good, that's very good. Relax, relax, relax. How are you feeling? If you had to rate your tenseness on a scale of 1 to 10, what would it be before and now currently? Okay, okay. We still have, a way to go for your treatment, but I think for today's session, it's a good start. Yeah, a very good start. We're definitely going to have you having a few follow-up sessions with us, Not everything can be fixed with one session, so we're going to need you to do your at-home homework. We're also going to need you to come in for at least 3 or 4 more sessions so we can fully dissolve all that stress.